So caring for gums, you can actually start from day one. Hi guys, I'm Dr. Dunn and we are here with Lauren, who is a new mother to baby Brenna, and we're here to talk about how to care for an infant's gums and eventually teeth as they grow up. Lauren, how old is Brenna?
So she'll actually be 2 months next week.
A lot of times at this age, babies don't have teeth. Some can. Some babies actually can be born with a neonatal tooth. But at this stage they're having a lot of either breast milk or formula, and the biggest risk that they have at this point is developing a condition called thrush, which is where the yeast organism will grow in the mouth. And as a mother, if you're breastfeeding, you can actually get the yeast organism on the nipple. And so it is important for good oral hygiene to kind of keep that to a minimum. But a good way to prevent it is to use just a warm washcloth on your finger, wrap it over your finger, and just do a little massage of the gums. It will help keep the baby's gums clean and keep it free of organisms that may grow in there. Using that washcloth technique to massage the gums in there, as they get a little bit older and they're more tolerant of having things in their mouth, there's a lot of great tools out there for getting them more used to the toothbrush that they're going to be using as they age. I have a couple of examples here that are sold in the stores. There's many different kinds that can actually get the baby used to having something in their mouth, even to their gum tissue. This is an example of kind of the next step that a mother would use, or dad could use, to take care of baby's gums. They really like these. They just have the little rubber bristles, and as the baby develops and they're able to grasp it, they might even use it as a chew toy, but you can use it to just massage the gum tissue in there. Sometimes they're more excited about it than others. But they also have little toothbrushes that actually go over your finger, and so it gives you a little bit more control to kind of just feel in there and massage the gum tissue. You as a mother or as a new father, you will find out what works best for you and your baby. None of these are particularly expensive, and you can get them at the different baby stores or local grocery stores or Amazon. As the baby develops teeth, which could happen anywhere between 4 months up to a year, some kids even get teeth even later, would be just a small-headed toothbrush. And this, as the teeth come through, allow you to clean up the plaque that develops on those teeth.
So what about toothpaste?
That is an awesome question. So when you start using a toothbrush, as the tooth has come through the gum, what is recommended is I just take the little first bristle of the toothbrush and I put it into the toothpaste as it's coming out of the tip of the tube, and just a little smear. Gets a little bit of fluoride toothpaste on there, helps protect their teeth. The amount that's in there is not much, so it's not going to harm them if they happen to swallow it. But getting toothpaste in there right away is something that is recommended by the American Academy of Pediatric Dentistry.
Awesome. So how about that first dental visit? When should we schedule that?
Absolutely. The first dental visit is something that, as Light Dental Studios, we follow the American Academy of Pediatric Dentistry's recommendation that a child should be seen when they get their first tooth or by their first birthday, whichever comes first. When baby has their first visit, we try to make it just a really fun and interactive appointment for them, and make sure they know it's not a scary place.
I've seen all different types of pacifiers. There's orthodontic ones. What is that?
Sure. I have a couple of examples of pacifiers. So I do have what is labeled as an orthodontic pacifier, and I have an example of a traditional pacifier. And what you can see in the difference is the orthodontic pacifier actually is flatter, and so it doesn't put as much pressure on the front teeth or the palate as it's developing. So the risk of moving things is less. But even with a pacifier, or if a child has a thumb sucking habit or a finger sucking habit, they're not a huge concern of moving the teeth. Yes, the baby teeth might move, but as long as the habit is actually stopped by the time that the child is losing those baby teeth around 6 to 7 years old, we shouldn't see a big difference in their permanent teeth. So if this is what your baby needs to soothe themselves or to fall asleep, it is not a bad thing. If it works for you as a new mom, you're trying to figure everything out, having your baby sleep well is really important. Thank you so much, Lauren, for being with us today to figure out all of how to care for your baby's teeth and gums. We're so happy for you, and congratulations on motherhood.
Thank you.
Stay tuned, like, subscribe, and share. Our next episode will actually be walking you through what to expect at baby's first dental visit.